Hello, so I chose question number 5, and this is my first day at the rehab clinic. I'm working with a paraplegic and a quadriplegic, and the major difference between the two is that a quadriplegic has limited to no movement or functionality in all of the limbs, and a paraplegic has limited to no functionality in the lower limbs. So these conditions are usually caused by a traumatic injury or blow to some part of the spinal cord, and depending on where on the spinal cord you're injured and how severe the injury is, that's what determines what limbs will be affected and how much mobility you'll lose. And besides injuries, it could be diseases or genetic anomalies like strokes, tumors, genetic disorders, oxygen deprivation. It could be a number of things. The most severe case of all of these is if you damage your high cervical nerves from C1 through C4. This will cause basically paralysis from the neck down. If your chest or diaphragm muscles aren't working properly, you won't be able to breathe on your own, cough, control your bowels or your bladder, and you will have speech impairment. And if you damage the lower cervical nerves from C5 through C8, you may be able to speak and breathe normally, but the rest still apply. And specifically for quadriplegia, another symptom is blood clots from slowed down circulation. And for paraplegia, that would be damage from the spinal cord, anywhere from T1 below, basically. And this can range from decreased sensation of the legs to tingling in the legs to complete paralysis of the legs. And because of these mobility limitations, either of these patients could expect to have pressure sores or bed sores from staying in one position too long, incontinence since there may be no control of the bowels or bladder, muscle spasms or phantom pain where you're feeling pain when nothing's actually hurting you, or the opposite, undetected injuries where you don't feel something that could be burning you or injuring you.